So this is the treatment for the unilateral extension sacrum. So the mnemonic for this is X, X, X. So for this one, I need to gap the SI joint. I'm treating the left side first. So the first X is external rotation, all right? And then I'm going to have the patient come up into lumbar extension. So she's going to come up on her elbows, which helps to drive the sacral base anterior. And then I'm going to contact that sacral base. I have an anterior and a little bit of an inferior vector. And as my patient takes a breath, she's going to exhale all the way out and hold an exhalation. That's the third X. As she does that, I'm going to augment that motion with a little bit of articulation in the anterior and inferior motion. When she needs to breathe, I'm just going to brace that sacral base from going posterior. She breathes out, holds exhalation, and I augment that again. And I would repeat that 3 to 5 times or until there's no more change, and then I would recheck. So if we have a bilateral sacral extension, then I'm going to do the same thing on both sides. So I'm going to gap that other joint as well, externally rotate the hip there to open the superior part of that joint, have her come up into extension one more time, and this one I can use my one hand in the midline, but focusing on the sacral base entirely and pushing that back into flexion, so anterior and a little bit of inferior motion. As my patient exhales and holds it in exhalation, I'm going to augment that anterior motion with a little bit of articulation. Again, repeat 3 to 5 times or until there's no more change, and then recheck.